Hey everyone, my name is Amanda Brower, and I want to talk to you a few minutes about patient care. So yesterday I was having dinner with my dad, and he was discussing about his current doctor. He was telling me that he had this amazing doctor, but she ended up getting a job at a different company, and the hospital that he's currently at decided to just switch him to another doctor. So he had this visit with this new doctor, and he explained that she pretty much just would type on the computer, ask him a question, type again, ask him a question. There was really like no concern for him personally. He felt like she wasn't even listening to him. I wonder if any of you have had similar experiences. In the medical field, whether you're in a doctor's office, a physical therapy office, a dentist office, patient care needs to be number one. And if it's not, then it's not where it should be at all. And it can turn away a lot of patients from those places. Why is patient care so important? The patients are number one in their health team. They're going to pick their team. It's about them. They're dealing with these illnesses, and they should have the best focus from this team that they can possibly get. Another thing is they're the biggest stakeholder. If they don't get better, they have to deal with those symptoms. So it's really important that they get that number one attention. Now, I work in a physical therapy office, so a little different than a doctor's office. But working one-on-one with patients, I understand that they want one-on-one attention. They want to be heard. They want their questions answered. And if we can't answer them, then they want to know who can and how to get those answers. If someone's been in therapy way too long, they can get frustrated. They feel like they're not getting heard. They're wasting money. And that can be a big problem. So one of the things I feel like is important is patient care. And I was talking to another colleague this past week about different clinical sites and where each one differs with patient care and how we can improve on that. Because as of right now, it doesn't feel like we have a big standard to really focus on patient care and get information from our patients and bring that back into our clinics. So that is the biggest thing that we have a problem with. Patient care can be measured by a couple different standards. The first standard is the structure. What's your building like? Someone doesn't want to come into a building that's run down, fallen apart. They want up to date, the best equipment, the most knowledgeable people. The other thing is they want is the process. They are coming in to see you, and if you have a ton of paperwork, a long wait, they're going to get frustrated pretty easy. And that is a part of patient care, even though it may not always seem like it. What about their outcome? If someone comes to see you and they don't get better, they don't have a good outcome. They'll go to somewhere else. It's not good for the company. So that's a pretty high standard. And even though this is at the last of the list, I honestly think it's the most important. Patient experience. Think of every time you walk in a medical office, whether it's sitting in the waiting room, how the staff greets you, how they answer the phone, how friendly they are, how the nurses assist you, how your therapist works with you one-on-one. That experience is everything. And you want your patients leaving knowing they got taken care of, they're better, and that they'll come back and see you. So my colleague and I were talking this week and really discussing how we could change this and how we could get some information back and really apply it into our clinics. And we discussed doing a survey. I posted a sample, if you look into the slides, of what the survey would kind of be like. It would just be a simple check, and then at the very bottom, they could leave some more informative comments. And we discussed that at the end of their treatment time, so whether they came for 1 visit or 6 visits, that we would give them a survey with an envelope that had paid postage on it, and these patients could anonymously send them back. They would go back into the company, not the specific clinic, and it would be put into a program that we could see what we're lacking in each clinic, what specific comments we really need to work on, and how to really improve each clinic to focus on our patients. If it wasn't for these patients, we wouldn't be here in the first place. That should be our number one job, not how many we get through the door, but giving the best absolute care to the ones that are there. Because if we do that, then more and more will come through the door. So think about all those times you went into a doctor's office. Think about your doctor now. Are they really giving you the best patient care? Is it what you want, or are you a little frustrated with it? Do you think we could apply more of these into more healthcare fields? Because I definitely do. I really think that patient care should be number one on any healthcare field office and their biggest priority to get you the best care possible. I hope you guys have a wonderful day.